Oregon Measure 110, Drug Decriminalization and Addiction Treatment Initiative 2020. This measure ensures funding of addiction recovery centers by October 1st, 2021, in order to provide drug users with triage, health assessments, treatment, and recovery services. This measure reclassifies the personal, non-commercial possession of certain drugs under specified amounts from misdemeanor or felony to Class E violation subject to either a $100 fine or completed health assessment by a center. Decriminalization will cover the possession of less than 1 gram of heroin or methamphetamine, 2 grams of cocaine, 12 grams of mushrooms, 40 doses of LSD, oxycodone, or methadone, and 1 gram or 5 pills of MDMA. This measure receives all marijuana tax revenue above $11,250,000 and any savings from law enforcement. It is estimated that this will save around $24 million from the decrease in arrest, probation supervision, and incarceration. This measure also requires the state to put at least $57 million into this fund per year, which is a roughly 15% budget increase on addiction treatment. The stakeholders who are directly affected by this measure are drug users and drug offenders, recovery centers, and law enforcement. While there is no change in taxpayers' contribution, the families of drug users and drug offenders are still indirectly affected because there will be more treatments offered for their loved ones, as well as the areas where funding was reduced will also be affected, which I will mention later. In opposition is the Republican Party of Oregon, Oregon Association of Chiefs of Police, Mental Health Association of Portland, Oregon Council for Behavioral Health, and Oregon Recovers. Oregon Recovers says, quote, Measure 110 is so poorly written it will lead to additional unnecessary deaths, further destabilize Oregon's fractured and incomplete behavioral health system, and will reduce enrollment in treatment centers across the state. It dismantles one system of intervention before building a new system. Measure 110 will reduce court referrals to treatment providers, which will lead to the closure of addiction treatment facilities across Oregon. Washington County District Attorney Kevin Barton says, quote, it will lead to increased crime and increased drug use. Oregon Council for Behavioral Health says, this measure provides no new funding, destroys pathways to treatment and recovery, and fails to address racial injustice in our systems. It fails to even consider our state's serious and persistent child and youth substance rate and access to care. And it falls short of addressing the wide-ranging impacts on access to treatment and recovery. In support is the Democratic Party of Oregon, Working Family Party of Oregon, National Association of Social Workers, Oregon Criminal Defense Association, and many others, as you can see. Managing Director of Criminal Justice Law and Policy at Drug Policy Action says, quote, the idea behind this groundbreaking effort is simple. People suffering from addiction need help, not criminal punishments. Instead of arresting and jailing people for using drugs, the measure would fund a range of services to help people get their lives back on track. Former teacher of emergency medicine at OHSU, Dr. Lowe, and board-certified physician, Dr. Strangeland, say, under Measure 110, anyone who wants services will be able to get them, not just those who have the funds or the right insurance plan. Measure 110 offers those struggling with addiction a way out while offering our state a path forward to treat addiction humanely and effectively. Former Director of Mental Health and Addiction Services for Oregon Health Authority, Richard Harris, says, if you put them in jail, you've only increased the amount might have declined because now they're unable to gain finance, work, and housing, unlike people who don't have a record. The first supportive argument is that Oregon has a long history of treating drug users solely as criminals, thinking that they will learn to just stop after they've been thrown in jail enough time, but we need treatment over incarceration. When users are treated as criminals, they are less likely to come forward to friends and family due to feeling like second-class citizens. Punishing people for drug use is costly and clearly has not worked. Plus, the lasting effects of an arrest, conviction, and criminal record make it much harder for users to get back on their feet since housings and job searching are largely restricted. Instead of being arrested, spending time in jail, and possibly going to court, users would be able to choose between $100 fines or to participate in a health assessment. As a result, this also helps to confront the overcrowding and over-incarceration of those who are accused of a drug crime by changing the conviction to a civil violation, such as a traffic offense. This is projected to decrease the number of convictions for drug possession by almost 90%. Secondly, a second supportive argument is that Oregon ranks number 1 in the country for pain reliever misuse, number 2 for methamphetamines, and number 4 for cocaine and alcohol use disorder. Portugal, Switzerland, and the Netherlands have all decriminalized the possession of hard drugs. According to these reports, there was no surge in drug use as well as a decline in drug deaths. Additionally, there was a 20% increase in those who were getting addiction treatment, which continued until these rates stabilized about 8 years after decriminalization. This switch to a health-based approach to addiction is what this country needs. With this measure, there will be funds set aside specifically to establish around a dozen new centers across the state, open 7 days a week, in order to meet the needs of people and connect them to healthcare services. Additionally, funds can be used to help house people with substance use disorders as well as harm reduction services such as needle exchanges. Firstly, in opposition, law enforcement plays a large role in getting people the help they need, and they believe that the threat of jail time, in some cases, is necessary to compel people into treatment and to stay with it. This measure also lacks goals and does not say how many people are actually going to be offered treatment while limiting the extent of intervention from law enforcement and prosecutors. Additionally, Oregon reduced its criminal penalties just back in 2017, and some argue that those who are convicted of possession rarely go to jail, that they're often offered probation of treatment through drug court programs that are in 26 of 36 counties. Secondly, in opposition, this measure takes money away from schools, state police, mental health programs, and local governments when there are already alternatives to jail time for most people who are convicted of drug possession. Without any new revenue, Oregon's behavioral health providers may not be equipped to handle the rise of new patients without a guarantee that the treatment programs can be scaled up, which may result in people waiting even longer for treatment. As a report by legislature reveals, Oregon only has 1,427 beds in residential treatment facilities, as well as only 201 in detox facilities. This makes people feel as though this measure will undermine the state's progress and fail to provide a real solution. Opponents of this measure also push the idea that decriminalizing these drugs is reckless and will lead to a rise in the acceptability of dangerous drugs. This could also lead to a rise in young people trying these drugs since it may influence their perception of the risks. In support of this measure, there was 5.7 million total contributions. The main donor has been Drug Policy Action with 4.5 million, with the addition of 4 other organizations. The More Treatment for Better Oregon Committee was a top committee to support this measure, which included a $500,000 donation from Facebook CEO Mark Zuckerberg and his wife on behalf of the Chan Zuckerberg Initiative. In opposition, there was just 94,500 in total contributions. Many have argued that this takes away one road without building a new detour. The struggle is that this is a very complicated and extensive issue. The only alternative plan that I was able to find was that the director of Oregon Recovers, Mike Marshall, had a plan to persuade legislatures to overhaul Oregon's addiction treatment system next year and fund more treatments with a tax on alcohol. What can you do to be involved? What you can do is to just be educated not only on this measure, but addiction and drug use as a whole. The stigmatization is a barrier in pushing new legislature, not just this measure, because if addiction and drug use are not socially understood and supported, then legislature will fall. So do your part in being educated in addiction and drug use as a whole.